When students struggle, it is very common for us to defend the rigor that's part of our academic program. Today, I want you to have a different thought. What if the confusion is really triggering and becoming a barrier to students having that deeper comprehension of understanding that we know is essential? Our ability to provide clarity when we are sharing assignments or even expectations of how to study for an exam or even a quiz. Oftentimes, students feel overwhelmed or they may just not know where to start. That's what we're going to talk about in our snapshot today. So, welcome everybody back to Dr. Sellars Educate, where our mission is simple. It is to support all nurse educator colleagues on the journey to achieve excellence. Now, for some of you, that's CNE. For others, it's CHESI, or maybe it's CNML. Whatever path you're on to achieve excellence, do know that we are here to support you until you are successful, no matter how long that takes. All right, so I want you to go ahead and follow the process that we do every time we join, and that is pulling out your resources. But I want to share my screen today and just talk more specifically about what those resources are and how you can navigate them to ensure that you're maximizing the time that you're spending reviewing content that is really going to help you achieve success. Okay, so in our snapshot today, we are specifically talking to our nurse educator colleagues that are on the journey. Dr. Caputi's CNE review book, you can see it on your screen. It is known as the Red Book, we like to call it. Well, there's a lot of value in this tiny book that we like to talk about. First and foremost, we call it the Cliff Notes version of how to get ready for the CNE. Not only does it help you prepare, but it also helps you have that deep comprehension of concepts, at least at the introductory level. Now, it doesn't go deep enough. We're going to talk about the resource to help you do that. However, this is an excellent resource if you're one of those colleagues that easily feels overwhelmed and there's a lot of information in our resources. This is a way to bring it down to a level that you're able to process it. It's broken down into pieces of micro learning that's going to help you truly have a definition, a solid definition of the concept. However, it doesn't quite go deep enough to that level of analysis that you need to go. Okay, so again, it does a great job of giving you a deep overview of concepts, but not really going deep enough to the level of application and analysis that is needed in order for you to achieve success. All right, but make sure you take advantage of the Red Book if you have purchased it or you're thinking about purchasing it. That is the benefit that so many nurse educator colleagues have shared with us. It is an easy way to review concepts because it is aligned with each chapter to coincide with the competencies outlined by NLN. All right, so I'm going to say that again. When you purchase the Red Book, the benefit is that each chapter is aligned with the competency, except for competency 5 and 6. So chapter 5 and 6 are flipped in the CNE review book. And the reason why is because NLN, they did revise the blueprint, the exam blueprint in 2023. Okay. And this book was actually published in 2021. So that's why chapter 5 and 6 are flipped. All right. So that's the benefit of the CNE review book. If you're wondering whether or not it's a book that you should purchase, this is the benefit of it, but you can also identify based on where you are in your journey whether or not this book would be helpful. All right, and then the next resource we want to talk about is the study worksheet. Okay, this is listed right here. There's a link right here in the description. This is going to help you stay focused. So you're going to write down today's date, your objective. So what is it that you want to walk away with? We're going to talk about what you should study and what you should avoid studying as part of your journey. And then you're going to write down competencies that you hear us talk about, resources. We've already mentioned one of them. We're going to talk about another essential one in just a second. And then what are some key takeaways as well as your 7 week study plan? As you're moving forward on your journey, we highly encourage you to follow a 7 week study plan. And there's a lot of reasons for this. Reason number one, and probably the most important one, is it gives you a solid structure to follow. As adults and as humans, we are attracted to structure. It provides clarity for us and it gives us a clear path to success or towards accomplishing a goal. I know in the spirit of 2026, just kicking off, many of us have New Year's resolutions or goals or objectives even that we want to achieve in quarter one. All right, so you want to have a clear path to help you actually accomplish those goals that you've identified. So the study worksheet is going to help you with that. The next resource is going to be Billings and Halstead. Okay, so we are using the sixth edition, but the seventh edition is available. The reason why we're using the sixth edition, if you haven't heard already, this is the one that was used when the exam writers initially announced in 2023 the new blueprint, and the questions that they actually developed was aligned with content primarily from Billings and Halstead. We like to call this our Bible. All right, so for our conversation today, we want to go ahead and jump into Billings and Halstead to engage in concepts that are going to help you close your knowledge gap. So this is going to be on page 255. There is a crosswalk that's also available if you have the seventh edition. It's right here in the description as well. Or you can email us info@drsellarseducate.com. Again, if you want the crosswalk for the seventh edition. Elsevier is a great partner, and they were kind enough to share the crosswalk with us. So we're talking about situated learning or situated cognition on page 255, chapter 14 in the sixth edition. We're just going to read a couple of the sentences, so follow along with us. Situated learning occurs in the context of the actual nursing practice setting. The goal is to bring real world, real life experiences into the academic setting so that students are better prepared to navigate the complexities often associated with the healthcare environment. This is a blending of instruction within actual communities where students have the ability to truly apply the concepts that we discuss in the didactic or in the classroom setting. This is also known to align with Kolb's experiential learning theory. I want you to go ahead and put in the chat for me or in the comments or on your sheet. Okay, if you don't want to respond in the comments, that's fine. But tell me how many phases are associated with Kolb's experiential learning theory. Now, we did go ahead and put a link up here that you can see on this YouTube snapshot to the actual presentation, and it's actually several series of presentations specifically to David Kolb's work as you are preparing for the CNE or as a nurse or as a nurse educator just wanting to improve your competency and your confidence in the classroom or in those learning experiences that you're developing for your students. It's really important to understand what happens throughout all phases of the learning cycle. I almost gave it away. All right, so again, page 255, Billings and Halstead, sixth edition, chapter 14 is where you're going to see information about situated learning. And right here in the link above on this, in this snapshot, you're going to be able to go to a series of discussions that we've had related to David Kolb's experiential learning theory. All right, so those are the resources that you want to focus on. We are continuing our conversation about what you should study and what you should avoid studying. Just like with our students that we develop teaching plans for in our classroom, it's great for them to have additional knowledge about concepts. However, we have to be able to focus on the must know and not integrate concepts that are nice to know. I was on a call today with colleagues, and we were talking about exactly that. When we're doing faculty observations, we want to make sure that the discussions and the lesson plans are aligned with the specific concepts that are identified in the syllabus or on the syllabus. So in order for us to effectively focus on concepts that students must know, we have to make sure there's curriculum alignment. All right, so we're not adding extra information that is unnecessary. That's exactly what we're talking about in this series. Now, not only is this information going to help you as a nurse educator, as a nurse, have a better understanding of how to properly prepare for the CNE exam, our discussion is even deeper than that. This is about higher order thinking for students as well. Oftentimes, what you hear us talk about here on as part of the Dr. Sellars Educate curriculum, whether you're listening to us on YouTube, on Spotify, or in one of our programs, we talk about a high level of application and analysis. Well, this isn't only important for us on the certification journey, it's also important for us to be able to connect with our students in a way that they're able to make safe patient care decisions. Okay, that's a big part of Patricia Benner's work, Bridging that Theory Practice Gap, and also Tanner's work, Tanner's clinical judgment model, as we talk more in our snapshot today about why that's so important. We have to share this testimonial that we heard from Professor Lagan-Horst. Many of you have seen this testimonial before, but this is why we want to share this again with you all today. Let's take a look at what she says, and then we'll talk about why. I utilized the Dr. Sellars Educate C&E self-paced online review course. I also purchased the workbook. I used the online review course coupled with the workbook and study suggestions over 7 weeks, and I was able to pass the C&E on the first attempt, feeling prepared and ready. I highly recommend to anyone who needs more structure during their C&E exam preparation. There were so many great suggestions that this faculty member shared with us. And our intent in sharing these testimonials is really twofold. First of all, there's a lot of programs out there. So credibility is really important, right? You want to choose a resource that's going to help you achieve success, not only on the C&E exam, also creating this transformation that is essential in helping us achieve our goals, achieving that higher level of performance in the actual classroom within those learning experiences that we are developing for our students. Another really important part of this professor's message is centered around preparedness and readiness. Just like with our students, right? We talk a lot about, research talks a lot about practice readiness. Well, our ability to help our students be more equipped with the skills and the knowledge, right? There's cognitive, psychomotor, and affective learning that happens through a student's nursing education journey. Students have to be able to demonstrate those skills and also think about the decisions that they're going to make. Well, that's exactly what Tanner's model talks about. And if you haven't figured out already, that's what we're talking about today. Not only are we digging deep into Tanner's model, but also faculty blind spot number 3. When rigor becomes a barrier, there's 3 essential elements we want you to consider as our conversation today unfolds into going deeper into not only Tanner's model, but also reflecting on the practices we are using every day in our classroom, in our learning spaces to help students learn. There's 3 key components tied to this topic, this blind spot. Number 1, rigor without support increases attrition, not excellence. I know we can often feel like there's so much content that we need to cover, and oftentimes we can leave students behind. We have to engage in those formative moments where we are checking in with our students to make sure we haven't left them behind, right? Just like our conversation today. I want to, and we've intentionally integrated check-ins throughout our conversation today, where you're responding in the comments, you're writing down on your paper. We're sharing stories, right? Relatable information where you can see yourself moving forward on this journey as well. And of course, we have our thought-provoking questions. So hang on for that because we're going to talk about that as well. And it's part of our debrief. In every session, we talk about not only celebrating you for the correct answer, also for clarifying the rationale for the incorrect and the correct answers. All right, so the number 2 component associated with this blind spot that we want to bring to your attention is challenge plus structure fuels persistence. Okay, this is really good. All right, so I'm going to say this again. Challenge plus structure fuels persistence. I want you to reflect on that statement for a few seconds. Think about the challenging situations that our students are often put in, and rightfully so, because we want to make sure that students have the knowledge, the depth of knowledge that we need them to in order to make safe patient care decisions. And now I want you to think about that structure part. So to coincide with you reflecting on a challenging situation, a challenging concept that students may have brought to your attention, what was the structure that was actually integrated into your course to help students have a better understanding of that concept, of that disease process, of that specific medication? Going back to our initial conversation topic, which is around how can we help students truly clarify any information, any concept, any procedure, any application of that specific intervention, how can we help clarify so students have the knowledge and the skills they need in order to achieve success, in order to give better patient care? And when we think about our individual journey, looking at how you move through the 7 week study plan or how you move through overcoming that barrier to help you achieve certification, structure is an important part because what happens? You have a 7 week study plan. You're going to persist more consistently and continue on the journey if you know what your specific goals are week by week. As opposed to thinking about, oh, I'm going to have to spend 125 hours reviewing concepts. Let's break it up into more processable parts so that you can have a clear path to success. Okay, so think about that challenging situation, whether it was a skill students really weren't connecting with, or maybe the formative assessment, that the information you got from that conversation or that quiz was shocking. Maybe you thought students had a better understanding of that concept when indeed they did not. Thinking about what structure did you provide? Were there specific study groups? Was there a learning guide? Was there specific outlines that students received to help them have a better understanding of that concept? All right, so that's what we mean by that. And then the third element we want you to think about related to the faculty blind spot number 3, clarity is not coddling, it is leadership. Now, I know in the classroom, students have challenging situations that create competing priorities. And oftentimes we can feel like students are wanting us to spoon feed them information. And some of that may be true. Here's the thought, though, I want you to consider. What if it is more about clarity? What if it is more about breaking down assignments into tangible parts instead of giving students a very large project that takes weeks for them to develop? What if students are able to submit parts of that assignment along the way and us giving them feedback? So there's a little bit of a checkpoint, right? Like we talked about earlier, checking in to make sure students are understanding what those expectations are, and most importantly, that they are delivering a product, providing a product, whether that is an assignment or how they're performing on an exam, and making those safe patient care decisions in a way that validates their knowledge. All right, so again, let's go back. So making sure you capture all 3. The blind spot was about rigor becoming a barrier. The 3 elements associated with that blind spot that we want you to remember is rigor without support increases attrition, increases turnover. Students are more likely to exit our nursing program. Number 2, challenge plus structure. Adding that structure is what's going to keep our students persisting, keeping them in our nursing program. And clarity. It is a statement of leadership, right? It is not about coddling. It is not about spoon feeding. It's about being clear about what our expectations are with our students so they can deliver success. They can achieve success. All right, so a thought-provoking question. Why do we have those part of our conversation anyway? Well, I'm glad you asked. This is a way for you to engage with us to enhance your nursing education knowledge and assess whether or not you are ready for the CNE exam. Now, we call them thought-provoking questions, if you haven't heard, for a reason, because it is about stimulating thought. Yes, we celebrate when you choose the correct answer, but it's even more of a celebration when you understand the why. Why is it that this option was correct? Why is it that the other 2 options were not? Just to recap, 150 questions on the CNE exam, and that is for CNE, CNE clinical, and CNE novice, okay? And you have 3 hours to take the exam. I always cover up my number 3, 3 hours to take the exam. And we highly recommend you go to a testing center, okay? So Measure Learning actually has a contract with NLN. They are the ones that actually facilitate the exam, okay? So once you get approval from NLN to actually go take the CNE exam, then you're going to set up and schedule that actual exam based on your communication with Measure Learning, all right? And the other point we want you to remember is when you're reading the questions, we want you to think about number 1, what is the question truly asking me? Number 2, what is it that I know for sure? During my call today as well, there were 2 other really key points that I heard in our conversation with colleagues. Number 1, it was that for some of us that are processors, After we ask students to read the question, or for here, Dr. Sellars Educate, we like to read the question to you. Having time, making time to pause to allow colleagues to process the information is a really important step. All right, so that's what we're going to do today. We're intentional in not only talking about evidence-based practices, but also utilizing them. All right, so let's take a look at this thought-provoking question, and then we're going to give you 10 whole seconds. All right, so don't leave us, stay with us. We're going to give you 10 seconds to think about and process the information and choose the correct answer along with your rationale. In a junior level nursing course, faculty have intentionally designed rigorous, high level assignments to promote clinical reasoning and professional judgment. Despite these efforts, students report confusion about expectations. End of course evaluations indicate that students are unclear about how their work is being evaluated, even though rubrics are posted. Which faculty action would best preserve academic rigor while improving student outcomes? A, clarify criteria and exemplars while maintaining high performance expectations overall. B, maintain current assignments and grading practices to reinforce rigor expectations. Or C, reduce assignment complexity and grading demands to minimize student confusion. All right, so we're going to give you all 10 seconds to think through those options and to choose your answer. All right, that was a long 10 seconds. It is hard, even for me, to honor the pause. However, we know that it is important to help our learners really process information that we're asking them about. Socratic questioning is another great way to engage our audience and do a little bit of a check-in. And it also stimulates additional thoughts, deeper thoughts, I like to say, as it relates to a concept. Now, we know sometimes with Socratic questioning, some students may not understand what we're talking about, especially if they have a lot of muddy points related to the concepts. And it's okay, right? Because that's a way of developing formative assessments with our students, Socratic questioning. So we have hopefully a deeper understanding about what is it that they don't know, as well as them. Partnership. That's what it's all about as students are moving forward on the learning journey that David Cope talks about. There are four phases, in case you all weren't sure. Earlier, we asked for you all to put in the comments, write on your study worksheet, how many phases of learning are associated with David Cope's work. There are four phases associated with his work. And this is what we know about his work as well. Our job, our responsibility as educators is to help students move through all four phases of the learning process. And his work also says that learning doesn't actually happen until students have had a hands-on experience. Now, we know how important that is in nursing, and it's great that his work really aligns with what we see in our nursing practice. All right, so hopefully you've had a chance to write down what your answer is. And as you're thinking through the correct answer, hopefully that you've chosen, and those other two options, we want you to also identify what is your rationale for making the choices that you did. All right, so now we want to talk through what the specific concepts are related to David Cope's work and Tanner's clinical judgment model. All right, so that's where we're going to go next before we unveil the correct answer. And we're also going to engage in something that's a little different than what we normally do, and that is we're going to flip over to Canva. So Canva is the presentation software that we use to develop presentations for our time together. The reason why we use it, well, there are lots of reasons. First and foremost is because it is more interactive and it is also web-based. All right, so we're going to use Canva and we're going to use Poll Everywhere. So Poll Everywhere is a type of active response systems that will allow you to actively engage with your audience, like Slido, like Kahoot. And this is what we want to ask you all to kind of talk through with us. We realize that you're not able to choose the option using your QR code. However, just know that As you can see with Poll Everywhere, you're able to ask students to respond in three different ways, and that can be a barrier for some students. Sometimes they may not have the technology, so you want to make sure that we decrease any barriers to learning. So we want to make sure students have access to the actual question that we're asking, that they can see it, right? Or that they're able to use technology. And if they don't, we want to provide alternative ways for all students to participate. That helps us create an inclusive learning experience. You can see that there's a QR code that students could scan. There's also a link here that students could respond that way, as well as a texting option. All right. And we do know that anonymity does increase participation because sometimes students may not feel comfortable. I know I was that student. I try not to be that student today, but if I'm not sure of whether or not the answer is correct, I may not raise my hand, right, for fear of embarrassment if I don't choose the right answer. So some students feel that way as well. All right, so let's see what your thoughts are about this one. Which preclinical activity would best ensure that learners are prepared for client care? We have number one, completing flashcards for the medications that their assigned client takes. Number two, discussing the pathophysiology of the client's diagnosis and two interventions. Or three, completing a reflection journal entry focused on feelings. All right, so this one was a little shorter, and we're going to go ahead and go over the correct answer now. The purpose of this thought-provoking question was really to share a different way to present questions to our students, right? Using Poll Everywhere, Slido, Kahoot increases active learning experiences that students are going to have. It also integrates and introduces technology, which we know helps students better prepare for the technology they're going to see in the clinical setting. All right, so we'll go ahead and click on the correct option so you can see that number two is the correct answer. What I love about these ARSs, active response systems, is that students can often see kind of how they are choosing their answer in comparison to others. I think there's pros and cons to that, right? We don't want students to be influenced by how others are responding because they may be right or wrong, right? Other students may be wrong, and the student that is choosing a different option than the majority may be the one that actually is choosing the correct answer. However, it does create just this different energy in the classroom whenever students are able to see what the responses are. All right, so you can see that's the correct answer there. Always using technology that we are hopefully trained to use is also going to decrease barriers. So again, number one strategy you want to use when it comes to technology is making sure that there are alternative ways to participate. So we're creating inclusive learning experiences with our students. And then number two, we want to make sure that we're properly trained in using that technology so that it's not a distractor. All right, so we've talked about the number three blind spot that you may have as a faculty member and three important considerations associated with that blind spot. And now we want to get to the core of our concepts that we're going to focus on in our discussion as we wrap up, which is Tanner's clinical judgment model. What is it that you want to focus on? Well, it's her model, right? Yes, we want to focus on what's actually happening in the four phases associated with Tanner's clinical judgment model. This is the actual full citation from the Journal of Nursing Education to support copyright requirements. But let's take a look really quick at what's happening. So the phase of noticing, students and caregivers have a clear understanding of expectations, right? And this is their initial grasp of information. This can happen, guess where? In the classroom. That's right, where students have a clear understanding of what is expected to happen regarding care of the heart failure patient. I'm expected to do an assessment. I'm expected to give medications. I'm expected to identify if there's something abnormal in the assessment. What are my next steps going to be, right? I'm interpreting that information and then I'm responding. I'm taking action. I'm looking at what the outcomes are going to be, or I'm actually thinking about what is the consequence? What is the consequence or the outcome or the response associated with the intervention or the action that I am going to take? Let me give you one brief example. For the heart failure patient, they're experiencing dyspnea. So I want to check the oxygen saturation. I'm going to listen to their lungs. It sounds like they have fluid in their lungs, right? So I'm interpreting all of the data that I'm gathering as a result of my assessment, right? And I'm thinking about, what did I learn in the classroom, in the SIM, and the skills lab? What was it that, what are the normal steps associated with care of the heart failure patient? And then there's SBAR that comes into play. I'm going to talk to the provider, and then there's going to be interventions, right, to help improve the patient's outcome. And then there's reflection that's going to happen. I'm going to think about what worked well, what didn't work so well, what might I do differently next time. We want to ensure that there's alignment with those teaching strategies that we have taught in the classroom with actual application. We want to go deeper, right, in preparing for the CNE exam. Why are we incorporating certain didactic content? How does theory align with practice associated with Patricia Benner's work? There are additional snapshots that can help you go deeper, not only with David Coe, but also clinical judgment model. Okay, so these are just some snapshot 14 and 17. What is it that you want to avoid studying when it comes to CNE preparedness? Checklists and decision-making algorithms. Again, yes, you want to understand why we use checklists. However, being able to develop clinical checklists and decision-making algorithms is not part of the content that you want to review. Looking over page 255 in Billings and Halstead related to situated learning is an essential part of your journey as you are achieving not only CNE success, but becoming more confident as a nurse educator. Okay, but we don't want to waste time reviewing information, in-depth information about checklists. You certainly want to have a good overview, but not spending time going deep into concepts is really what we're talking about related to the checklist. All right, so now we're ready to wrap up. We'll go back to our thought-provoking question and hopefully celebrate that some of you chose the correct answer. If not, that's okay. That's why it's called a thought-provoking question, right? It's expected that you learn more information about the specific concept than probably what you had initially. All right, so those of you who chose A, give yourself a round of applause. You are correct. And now let's talk about the why. So A says clarify criteria and exemplars while maintaining high performance expectations. Why is this so important? Well, A is going to preserve the rigor, and we're going to add clarity, alignment, and transparency. These important steps all allow our students to meet those high expectations without lowering the cognitive demand and the rigor, right? We don't want to justify rigor. We want to provide clarity to ensure there's alignment between expectations that we have of our students and the pathway, that structure that they should use to help them achieve success. B would maintain the rigor, but it fails to address the source of confusion. And then C improves clarity, but it's by dilution, right? Which is going to weaken our academic standard and rigor. And that's not what we want. All right. So if you chose A, give yourself a round of applause. Hopefully, if you chose the others, you now understand why those options B and C are not the best answer. Taking time to pause, reflect, and then act to make a decision to revise curriculum, to revise our exam question is an important part of our reflection journey. If you're still struggling with figuring out what resources to help you reflect or even sometimes to debrief, then looking at Rooted in Wisdom, our 365-day devotional, is an excellent recommendation that we would have for you. There's more information that's also listed in the description. So what's your number? You all know we like to do a temperature check before we close out. How do you feel about the content that we discussed today? We went deep. We started with the blind spot, but we went a whole lot deeper related to Tanner's clinical judgment model and what specific steps you want to take, not only in helping your students achieve success, also helping you achieve success as you move forward on your certification journey. Or maybe you're 5, you feel ready to teach, which is really amazing as well. That's the great thing about teaching. We actually get to learn twice. We get to learn the content, having that deep understanding of the concepts that we're teaching, as well as learning how to facilitate the learning with our students as they move forward on their journey. We hope that this snapshot has been helpful, and we appreciate you for staying until the end. Make sure you subscribe. That's what keeps us connected to you as part of our audience, part of our community. Reach out to us on our website if you have any other questions, and we look forward to seeing you in a future snapshot. Have a great one, everybody.